Good afternoon, everyone. My name is Danielle Sartori. I am the physical therapist here at the Knee Joint. And today I have a special guest for you, Jonathan Huang. He is a physical therapy student intern from the University of California in San Francisco, UCSF. He's getting his doctorate in physical therapy. And today he will be presenting to us the effects of early sports specialization in youth athletes. He will be talking to us about what sports specialization is and how the effects it can have on the children and teens of our community. And without further ado, here he is to give us what you got. Let me mute.
All right, thank you so much for the intro. So before we get started, again, my name is Jonathan Huang. I'm a student at UCSF. I just started my second year before doing my rotation here at the Knee Joint. So I'm going to share my screen and then we'll get started with the presentation. Again, my topic is on early sports specialization in youth and how it affects them. Let's get started. So first things first, let's define what sports specialization is. And so the definition is really based on three criteria. Is number one, choosing a main sport. And number two, you're quitting all other sports that you used to play to focus on said main sport. Or if you only ever played one sport and you stuck with it the whole time, that also counts as well. And then number three, you participate in year-round training, playing games, tournaments, etc. And a year is defined here as greater than 8 months per year. And so why do we care? I mean, sports specialization, that sounds like a good thing. You're going to focus on one thing, get really good at it. You know, why is this such a problem? And so I'm sure you guys heard of the quote before, 10,000 hours is the magic number of greatness, or something along the lines of that. And this was said by Malcolm Gladwell in his book. And so in his book, he talks about how you have to practice something for 10,000 hours to be considered elite within a skill or craft. And again, this quote seems like a great thing. Why is it so harmful? Well, I'm sure playing the piano for 10,000 hours, you become Mozart. You paint for 10,000 hours, you become the next Picasso. But if you play basketball for 10,000 hours, does that make you the next Kobe Bryant? Well, I don't know. We'll see. And so this is a concern because youth athletes nowadays are actually specializing at a younger age. And during this age, they're actually still maturing. And so again, they have immature bones still. Combined with the overtraining, insufficient rest that comes along with sport specialization, and also poor conditioning, which can lead to injuries within these youth athletes. And youth sports has now become a business with so many club teams, elite programs, summer programs, all this, all in the hopes that one day your youth athletes can push for the big leagues, scholarships, NCAA, and maybe even professionally. So we really care about the scholarship here. So before I get into why sports specialization is bad, let's talk a little bit about the benefits of sports specialization. And so number one, with sports specialization, you're really exposed to a lot of the repeated training and movements. And this is pretty beneficial for motor skill acquisition, fine-tuning of the craft, really getting a lot of exposure to the game sense, finding tactics that work for you during the game. However, there are limitations, as we'll learn in the disadvantages portion of this presentation. And with increased time in the sport, you get increased exposure to recruiters and potential to showcase your capabilities. And so I have a picture here of recruiters and scouts. I'm sure they're timing the pitch of some athlete. And so now we'll get into the disadvantages of sports specialization. So number one, and the biggest one of all, is overuse injuries. And we see this a lot in the clinic here. and also the psychological effects that can come with sport specialization, especially at such a young age. And so today we're actually going to focus a lot on the presentation on the overuse injuries portion, but we'll brush up on the psychological effects as well. And so overuse injuries usually caused by the repetitive nature of the specific movements within the sport specialization, because there's not a lot of variety of movement patterns, and without the sufficient rest, it can lead to overuse injuries. And some of the injuries are, but not limited to, tendonitis, apophysitis, stress fractures, and muscle imbalances. And these youth athletes are more susceptible to these injuries because of their growth plates called physis, and the fact that their skeletal muscle is still maturing and developing. And so we'll see a couple of examples here. And so before we get into any specific examples, let's define a few of these injuries. Tendonitis, which is inflammation of the tendon being the structure that connects the muscle to bone. If not treated properly, tendonitis can actually escalate to tendinopathy or tendinosis, which is chronic degeneration that leads to scarring of the actual tendon tissue itself. And so chronic is more of a long-term injury, so we want to avoid that. And apophysitis is the inflammation or stress injury on or around the growth plates of the bones in the adolescence. So this can occur with overuse of a muscle. The muscle and the tendon connected to that bone is constantly pulling on that growth plate. It can cause some inflammation to the growth plate around there. And then stress fractures. Overuse of the muscles lead to inefficient shock absorption because the muscles will eventually fatigue. And the overload of the stress that the muscle can't handle any longer is now transferred to the bone, which can cause microfractures, little cracks in the bones, and muscle imbalances. So in sport specialization, sometimes you'll prioritize one side, like pitching. If you're right-handed, you'll most likely be using your right, or you're prioritizing one plane of movement, like a runner, only linear, none of that side-to-side training work. And so what happens is the opposing side will become weaker. And so let's go into a specific example of tendonitis. We have swimmer's shoulder, which is repeated stress in the shoulder joint that causes irritation to the surrounding tendons and muscles. And this can cause muscle weakness, reduced range of motion, shoulder instability, and pain. It doesn't just happen to swimmers, although it is prevalent in swimmers. It could happen into any repetitive overhead activity sports, such as baseball or tennis. And common treatments is RICE, which is rest ice, but heat taping, sometimes people do as well. And of course, physical therapy. Let's go into the next example of apophysitis, Osgood-Schlatter's disease. And as you can see here, it is a repetitive and overuse injury that causes a painful protrusion and swelling below the kneecap. And so it's usually in the shin bone called the tibia. And it's prevalent in youth athletes who play sports that involve a lot of running and jumping. And if you're cycling through sports in your head that involve a lot of that, that's a lot of sports. And this is actually the most common cause of knee pain in children and teens. Common treatments is rest, ice, compression, elevation, and again, physical therapy. And so if you know someone who's experiencing this, send them to the knee joint. And then now we have an example of stress fracture, specifically runner's stress fracture. And so again, this is a repetitive load, and you see a pattern of repetitive load and overuse in a lot of these injuries, leading to muscle fatigue, which transfers the overload of stress to the bone, and then again, it causes microfractures or a small break within the bones. It usually starts as a dull pain and weakness in the lower extremities, in the foot, the lower leg, tibia, and then it'll start escalating towards a sharp, deep, localized pain. It is common with overload of running, jumping, And then even in populations that are not as athletic, if they have a condition of where their bone become weaker, such as osteoporosis, normal use of these structures can actually cause stress fractures. And so common treatments is rest, ice for the pain. It does not actually heal the bone itself. So don't think ice will heal the bone. Casting, bracing, and physical therapy. And then last but not least, muscle imbalances. And so muscle imbalances itself is not an injury, but it can lead to one. And so with muscle imbalances, it can lead to increased stress on non-contractile structures such as joints, tendons, and ligaments, and it can also increase muscle tensioning and shortening. The injury is then caused by compensatory or dysfunctional movement strategies due to the dominant strength and tension on one side of your body or one plane of movement. And so with the runners example that I said earlier, I'm sure they're great at that linear going forward, running for endurance. I'm sure they're great at that, but put them in a situation where they're gonna have to dodge side to side. One of these movements that they're not used to, not as strong in, they might, injure themselves. And so muscle imbalances affects everyone, not just athletes. For example, poor posture is a form of muscle imbalance because you have a weak mid-back and upper neck, and then the shortened, tight upper back and chest muscles can lead to this rounding, leading to that poor posture that we see. And so let's talk a little bit about the psychological part of sports specialization. And so with sports specialization, I'm sure you can imagine that there's this constant focus on perfection and performance. You have your pressure from your parents, coaches, peers, and your teammates, and your pressure to fill these athletic shoes because you've always been an athletic person, right? And so all of that can lead to stress and anxiety, diminished drive, and overall loss of enjoyment for the sport, especially if you're mainly playing now because your parents put so much money into putting you into these summer camps. And then you have to perform because your coaches are yelling at you. And so these feelings can then lead to burnout, which is defined as an overwhelming physical, emotional, or mental stress, leaving one drained and unable to keep up with the demands, and the demands being an athlete. And so here we have a few statements from athletic societies. And so here we can see we have pretty much a summarized version of their position on sports specialization from American Academy of Pediatrics. They discourage it. American Medical Society for Sports Medicine, they discourage it. American Orthopedic Society for Sports Medicine, they also discourage it. And so you can see so many of these associations discouraging early sports specialization. We have the International Olympic Committee, and they say it's only acceptable if there's a broad range of biomechanical exposures within the sport. And so that goes and ties back to how sports specialization really promotes that repetitive, same type of movement. And so that's why we want to make sure that there's an array of movements if you do decide to do sports specialization. And so let's move on to the conclusion. All right. And so physical, emotional, and mental well-being of our youth athletes are the priorities, not the trophies that they earn. Sports specialization should be done after major developmental years. And we should allow for free play if they do sports specialization. But, it would be ideal if they were involved in multiple sports. And free play is defined as an outlet of physical activity exploration. So it doesn't have to be an organized sports itself. It could be something as simple as letting your child go out and ride their bike, run around playing tag with their friends at the park, things like that, because that will start introducing different planes of movement, and they're not gonna fatigue the same muscles that they're using playing the sports. And understand and recognize early signs of injury and overtraining. And so if we have any questions, I've left a little time for that. But if not, here are my references. And I'd like to thank everyone for listening, if you're tuning in or watching live. And thank you to the NEJAP for hosting me for the past 10 weeks and showing me what it is to be a clinician. So thank you so much.
Thank you, Jonathan, for your time. Nice job and great information. It'll be up on our blog soon.
All right. Take care, everyone.